Hi, I'm Dr. Fitz, North Edmonton Chiropractic Clinic in Edmonton, Alberta, Canada. I'm here with Colin, and he's going to be a patient today to just demonstrate some of the things that we do as chiropractors in regards to examination. Just brief examination, not a full-length examination, but a brief examination and what manipulation looks like. So first of all, when Colin comes to me and he's saying, you know, I'm not too bad, but I'm a little tight and I've been having headaches, I start palpating, and I'm looking at range of motion as well. So I'd say, Colin, look to the right as far as you can, rotate to the neck as far as you can to the right, and I'd rate that at about 70 degrees to right. Now to the left as far as you can, and he's about 70 degrees to the left. Then I say, look up as high as you can, all the way up, and there he's about 60 degrees of extension, which is fairly good, and then down all the way chin to chest. Are you having any pain doing that, sir?
Not yet.
Yeah?
Not yet, a little bit of tightness.
Yeah, now look up as high as you can, and now rotate to the left, and rotate to the right. Which is more uncomfortable?
Left.
Left, okay. So then I'll go in and I'll start palpating, and this is where the skill of being a chiropractor, where you have developed a palpation ability, like a blind person can read Braille. Chiropractors are sensitive in their fingers to locate where the muscles are hypertonic or tight when there's tension, or there's a thing called subluxation, which is a mechanical dysfunction or mechanical dyskinesia, meaning the joints of the spine aren't moving properly. So I can feel right in this spot right here that Colin has subluxation at C5 and 6 on the left side of his neck, and he has a really tight muscle in that same zone. So we're going to do an adjustment on you, Colin, and I want you to lay on your back right here on the table. So typically when I do an adjustment, I put a little cream on my finger and do a little massage first to loosen it up, and the analgesic cream kind of takes any of the discomfort of the adjustment away. And I can also feel a little bit better when Colin's neck is relaxed. Now his muscles are in a static position because he's not holding his head up, and I can feel that muscle and a few other ones even a little bit more. So a manipulation is more noise than it is painful, but because his ears are about 2 or 3 inches away from the adjustment, he's going to hear this clicking or popping sound. Now people want to know what that sound is. It's called a cavitation, and cavitation is just the gases that come out of the knuckle joint when they're released are nitrogen gas that's coming out of the liquid in the fluid, of the synovial fluid, and it's just creating a vacuum, and there's a popping noise. It's not the bone rubbing on anything, and there's a release of pressure as the bone is increasing in its range of motion. So I'll take Colin's neck where it's stopped moving at its and it's feeling blocked and it's not turning any further at that particular level that's tight. And I know exactly where the problem is, and I'm going to do a little push, and you'll probably hear a little clicking noise right by his ear. And there. That's a chiropractic manipulation. Usually I stop there and say, that was for a first-time patient, that's definitely more noise than pain, and they say, yeah, is that it? Is that all? And because they were expecting that it was going to hurt, and it really isn't painful at all. I'm going to do one right here, and that was a neck adjustment on Colin. When a chiropractor goes through the ranges of motion, he puts pressure on every spinal joint, and he finds out which ones are locked or blocked. And usually the ones that are blocked, they don't move very good, and there's pain or discomfort in the area. And you can tell that right here in the middle of Colin's back is some issues that are not 100% working. Why don't you lay on your back, Colin? Bend both knees. Okay, slide down just a little bit. Cross your arms over your chest. And I'm going to do adjustment right here at about T7. Breathe in and breathe out. All the way out. There you go. Now lay on your right hand side. Just let it loose. Right in here. Good. Now go to the other side. You've been waiting for this all day, haven't you?
I've been waiting for it for a week and a half, actually.
Okay, right there. sideways. Right in there. Perfect. Go on your stomach. So after the manipulation, I usually like doing a little massage. I use some vibrating units to help relax the muscle. Sometimes I will use the massage before I do the adjustment. And if the patient comes in and he's in spasm or really tight, we'll actually heat it up with heat packs for about 10 minutes before the session, just to loosen the area before we do any manipulation. So I'm going to do a little TENS machine on Colin before we quit this today, and I'm going to leave him on this for 10 minutes. Our method of doing this is putting a little ultrasound gel, and then we put tacks that are reverse side up, and we hook electric therapy, in this case a TENS machine with alligator clips onto those spots, and then we turn the machine on to a comfortable level. How's that there, Colin?
Wonderful.
Feel it? And I'd leave Colin on this therapy for 10 minutes, and it just stimulates the nerves to block any pain, and it massages the muscles to relax them. And it also causes Colin to stay in this position for 10 minutes and not lose some of the benefit. If this here helps keep him in position and relax his body and get his body used to the new movement and range of motion introduced by the adjustment.